Ever wondered, what are the early signs of pregnancy? It's a question that has likely crossed the mind of many, especially those planning or expecting a baby. Recognizing these early signs is crucial, not just for the joy of knowing you're about to embark on one of life's most incredible journeys, but also for the essential prenatal care that can ensure a healthy pregnancy. However, it's important to understand that these signs can vary significantly from person to person. What one individual experiences might not be the same for another, making it somewhat of a unique journey for each expectant mother. So, while we're about to share some of the common early signs, remember, they aren't set in stone. When in doubt, it's always best to consult with a healthcare professional. They can provide confirmation and guide you through this exciting new chapter of your life. So without further ado, let's dive into the common early signs of pregnancy. First and foremost, a missed period often prompts women to take a pregnancy test. This is an understandable reaction as it's one of the most widely recognized early signs of pregnancy. However, it's important to remember that a missed period doesn't necessarily mean pregnancy. It can also be a result of other factors such as stress, significant weight changes, or irregular menstrual cycles. Our bodies are complex systems, and they can sometimes throw us curveballs. Stress can significantly impact your menstrual cycle, causing it to be late or even skip a month. Similarly, sudden weight loss or gain can disrupt your cycle, making it difficult to predict when your period will arrive. And let's not forget about irregular cycles. If your periods are generally unpredictable, it can be tough to determine whether a missed period is an early sign of pregnancy or just business as usual. But a missed period isn't the only sign to look out for. Feeling nauseous? It might not be something you ate. You may have heard of morning sickness, but it's a bit of a misnomer. This early sign of pregnancy can strike at any time of the day or night. While the name suggests it's a morning occurrence, don't be fooled. This queasiness can sneak up on you during lunch, dinner, or even in the middle of a meeting. Morning sickness usually kicks into gear around the 6th week of pregnancy. This means it's one of the earliest signs that you may be expecting. It's believed to be caused by the sudden surge of hormones in your body. But remember, every woman's body is unique and responds differently to pregnancy. Some women might not experience morning sickness at all, while others might find themselves reaching for a cracker before they even get out of bed. Next, let's talk about another common sign: breast changes. Have your breasts been feeling a bit different lately? This could be another early sign of pregnancy. Breasts may start to feel tender, swollen, or heavier than usual. This is due to the hormonal changes that occur in the body shortly after conception. You may notice these changes as early as 1 to 2 weeks after conception. They might feel similar to the changes your breasts undergo before your period, but often they're more intense. Additionally, the area around your nipples, known as the areolas, may darken in color. This can happen because the body is preparing itself for breastfeeding. The darkening of the areolas is a natural process that helps the newborn locate the nipple for feeding after birth. Remember, while these changes can be uncomfortable, they are a normal part of early pregnancy and a sign that your body is preparing itself to nourish a new life. Now, let's move on to fatigue. Feeling unusually tired and low on energy? Well, it's not just you. Fatigue is a common early sign of pregnancy. This sudden drop in energy level can be attributed to the increased levels of the hormone progesterone. Progesterone is like your body's natural sedative, and it can leave you feeling exhausted. But remember, fatigue is not exclusive to pregnancy. It can be associated with a myriad of other conditions, from a simple change in diet or sleep pattern to more serious health issues. So, if you're feeling unusually tired, don't jump to conclusions. It could just be your body telling you to slow down and rest. However, if this fatigue is accompanied by other signs we've discussed, like a missed period or morning sickness, it might be time to take a pregnancy test. Trust your body, it knows what's going on. And remember, every pregnancy is different. Stay tuned as we delve deeper into our next topic. Lastly, let's discuss frequent urination. Making more trips to the bathroom than usual? If you're nodding along, this could be another early sign of pregnancy. Now you might be wondering why. Well, it's largely down to hormonal changes taking place in your body. Once you're pregnant, your body goes through a lot of changes, and hormonal shifts are a big part of it. One of the hormones, human chorionic gonadotropin, or HCG for short, increases rapidly. This hormone specifically can cause an increase in blood flow to the pelvic area. And here's the interesting bit. Your kidneys react to this extra blood flow by processing more fluid. And guess where this fluid ends up? You got it, in your bladder. This could lead to more frequent trips to the bathroom than you're used to, usually starting around 6 to 8 weeks into the pregnancy. But here's a gentle reminder. Remember, these signs are common but not definitive. It's always best to consult with a healthcare professional if you suspect you might be pregnant. As we've discussed, early signs of pregnancy can vary widely. Each woman experiences pregnancy differently, with signs and symptoms that can be as unique as the women themselves. But there are common threads that tie these experiences together, threads that we've been unraveling over the course of this video. We started with the most commonly recognized sign, a missed period. When the monthly cycle skips a beat, it can be a strong indication that something new is beginning. But, as we've discussed, it's not a definitive sign. Other factors like stress or changes in weight can also affect your cycle. Next, we delved into the world of morning sickness, a misnomer that doesn't just strike in the morning but can hit at any time of day. This wave of nausea and possible vomiting is a classic sign of early pregnancy. Yet, it's not a universal experience. Some women may never feel queasy, while others might feel nauseous throughout the day. Then we moved on to breast changes. Soreness, tenderness, a change in size or color. These are bodily changes that can signal the start of something extraordinary. But again, they can also be symptoms of other conditions or hormonal changes. Fatigue then came into the picture. The overwhelming tiredness that can descend in the early stages of pregnancy is another common thread. Yet, it's a thread that can be tangled with other factors like stress, poor sleep, or illness. And lastly, we discussed frequent urination. The need to constantly dash to the bathroom can be another early sign of pregnancy, but it can also be linked to urinary tract infections or increased fluid intake. Despite these signs, it's important to remember that they are not definitive proof of pregnancy. They can be indicators, yes, but the surest way to know is to take a pregnancy test and consult a healthcare professional for confirmation. Stay in tune with your body and always consult with a healthcare professional when in